Grace and peace to you, my friends. Question. What do you have to do to land yourself in the doctor's office? Could be any number of things, right? You could end up in the doctor's office because you did something foolish or silly or careless or unsafe for any number of days in a row or years in a row. You could be in the doctor's office because you just don't feel well. You're not sure what's going on, but things don't feel right. They don't feel like they should. They don't feel like they used to. You could end up in the doctor's office because it's just time for a checkup. Nothing really that you can tell is going on, but it's been a while, and so you just want to go get checked out and make sure everything's okay. You could end up in the doctor's office not because of anything that you did, but because of something that happened to you. Some sort of injury or traumatic event or accident that happened. There's lots of reasons you could end up in the doctor's office, but once you're in the doctor's office, what matters most? In my opinion, the wisdom and skill of the doctor is what matters the most. When you're sitting there on the piece of paper on the high bench bed thing that you sit at, and you're looking around the room at all the plastic models of skeletons and framed pictures and doodles and artwork, or maybe murals on the wall, and all the racks of magazines and the little glass jars of cotton balls and cotton swabs and tongue depressors, and you're wondering what goes in there and what that does. When you're sitting there, if you've got a wise and skilled doctor, it doesn't really matter how they're going to treat you, with what treatment they're going to treat you. It doesn't really matter how long they say it's going to take for you to get better. It doesn't really matter to you what you have to do. Whatever they say, whatever they recommend, whatever they advise, you're going to take what they prescribe as they prescribe it. You're going to wait the amount of time that they say it's going to take to get better. And you're going to be looking the whole time for signs of improvement, expecting to see that things really are progressing and advancing along with their predictions. In short, you're going to trust them if they're wise and skilled. You're going to trust that the doctor knows exactly what's wrong with you, knows exactly what to do to fix it, and knows that everything is going to be all right as long as the treatment carries along the way it's supposed to. You said, Jamie, why are we talking about this? The reason that I was thinking about this morning was my mind throughout these past couple of months keeps replaying this call, this admonition to you and to me, that the life of a Christian is a life of patient endurance. Being a Christian means being patient. It means having patience. And the truth is, being patient and being a patient, they have something in common. And what they have in common is that typically we don't like either one of them. I don't like to be patient, and I don't really like being a patient either. The difference between the two, even though they have that in common, the difference is usually the reason that I don't like being patient is because I have no idea how to be patient. I know that I'm supposed to, and I have I guess an idea or an impression of what's supposed to happen if you're being patient. I have no idea how to do it though. I don't know how to wait any better than I normally wait. But weirdly, I do know how to be a patient, even though I don't like to be a patient, and it's not fun, and it's not, exciting or entertaining. I know exactly how to do it. I know how to be a patient. Whether or not I'm able to be a patient has to do with whether or not I trust my doctor. Because what stops you from being a good patient is if you don't trust your doctor. You're not going to take all of your medicine as it's prescribed. You're not going to believe that everything's going to get better. You're not going to wait with hopeful expectation as the treatment progresses, looking for signs that things are actually improving, if you don't think that your doctor knows what's really wrong with you, knows how to fix it, or even can know that everything can get better. The opposite of a doctor is a patient, and the opposite of a patient is someone who refuses to be treated and insists on treating themselves, refuses to follow a course of action from somebody who knows better and insists on doing what they think will make things better. I don't know how to be patient, but I do know how to be a patient. And my encouragement to you, my suggestion to you, is that if you want to be better at being patient, perhaps it's time to look at our situation as if you are a patient. And here's a really important question. Do you trust your doctor? I mean, if you think about what has landed you into the particular situation that you're in, we could be talking about things that have happened to the world that you have no control over, you have no responsibility for, and yet here you are dealing with them. Or you think about the fact that something in your life might be broken. Something in your life might be overactive and something might be underactive. Maybe you just don't feel right, given everything that's going on, or you don't feel like you used to, or maybe you can't tell what's wrong and you're just looking for a checkup. You're just looking to be told that everything's going to be okay. Whatever situation you find yourself in, if you're trying to wait patiently through what's going on, maybe waiting like a patient through what's going on can help. Do you trust your doctor? Do you actually believe that God knows exactly what's wrong right now? He knows exactly what's wrong. Do you actually believe that he knows exactly what needs to be done to fix you and your situation and the world around you? Do you believe that what he has prescribed, what he has set forth as how it's going to get better, do you actually believe that it's going to work? That it's actually going to work? Because if you trust God, if you believe that he is wise and skilled and at work carrying out his treatment plan, then what you're going to end up looking for as you look around is signs that things are improving. You know it's going to take a while. You know that the pain doesn't stop just because he's figured out what's wrong. You know that setting your bone hurts just as much as breaking your bone. You know that there's going to be discomfort and there's going to be waiting. But if you trust your doctor, you know that every day that moves forward, your waiting is a waiting of patient endurance, hopefulness, searching for signs that things are progressing the way that they should. I don't know if this is losing you. It's just something I was thinking about today. We know that we're called to be patient. And since we don't know how, but we do know how to be a patient, perhaps something to ponder this week would be, what would it be like for you to go into this week thinking about being a patient, knowing and trusting that the good physician knows exactly what's wrong, knows exactly what needs to be done to begin to address and to heal you and the world around you, that he has a plan and that he's sticking to it. And all you have to do as you wait for it to work is to just trust him and fix your eyes on signs that things are getting better in you and in the world around you according to his plan. Hopefully that's helpful. I'll see you guys on Sunday with a sermon about the Pentecost. God's peace and blessings to you. May the Lord bless and keep you. May he make his face to shine on you and be gracious to you. May he look upon you with favor and give you his peace. Go in that peace and serve the Lord. Thanks be to God.